Provisionals, why do they matter and what are they? Well, provisionals is the technical term for temporary, and a temporary is done for teeth that have been prepared for a crown, a bridge, an inlay, or an onlay. I've mentioned before that for a veneer prep, because minimal tooth structure has been removed, the need for a provisional or temporary is not necessary. Again, it's going to depend on the dentist. With provisionals, the whole purpose of them is to reduce any sensitivity or discomfort the patient may be experiencing as a result of those teeth being prepared. As I've mentioned and as you've seen, majority of the tooth structure is removed to accommodate something to fit over the top, and oftentimes a lot of that enamel is removed, exposing the dentin. And the dentin, because of the dentinal tubules, can cause some sensitivity that we definitely want to try to avoid, because typically a patient is in a provisional from 2 to 3 weeks. So we want to make sure that they're going to be comfortable for that amount of time. It's also to maintain the function and aesthetics of those prepared teeth. As you've noticed, when the teeth are prepared, a lot of that structure is removed, and oftentimes patients aren't going to want to be seen like that. And it's going to prevent them from possibly being able to speak properly. And it's definitely going to hinder them eating if a temporary wasn't placed over the top of it. It's also to protect the margin of the preparation. So the margin is created around sort of the neck of the tooth, and we pack cord to displace that gingival tissue around that gingival sulcus for a reason, because when we put the permanent crown in there, as the tissue heals, it's going to fit tightly against that crown, which is what we want. Remember, we want to try to avoid any kind of gaps or spaces, because that's just going to harbor bacteria. So it's maintaining the integrity of that margin by having that provisional in place. Looking at these pictures here, this is what a good provisional would look like versus what a bad or poor provisional would look like. With this one, not only does it not look good, but we can see that this material of this provisional is sitting on top of the gingival tissue, which is just going to cause irritation, redness, and a lot of discomfort for the patient. But on top of that, it's also not maintaining that integrity of the tissue being displaced because the temporaries are fitting so poorly. So this is going to be a disaster when it comes time to try to cement or bond the permanent restoration or bridge into place, because the tissue is, one, going to be very unhealthy, and it's going to bleed a lot, which is something we need to make sure when we're bonding something into place, that there's no bleeding whatsoever, there's no moisture whatsoever, because that's going to prevent the material, the adhesive, the bond from actually working. So this is just an overall bad provisional crown that you want to make sure that you are avoiding if you are the one who is creating the provisional. And also, it's to prevent any shifting of adjacent or opposing teeth. So as I've mentioned before, anytime a tooth is lost, and it's not that the tooth is lost in this case, it's just been prepared down, what's going to happen is the teeth next to it, in the 2 to 3 week period, it may not seem like a long time, but those teeth will start to drift into that space. Not only that, if it's a lower tooth that the preparation was done, it can start to have the upper opposing tooth or opposite tooth of the tooth that's been prepared to start to sort of migrate downwards. Remember, our teeth act kind of like placeholders, and it keeps everything where it's supposed to be. When that is missing, then the teeth sort of compensate because there's nothing there to maintain that space. So these are all the purposes and functions of provisionals, which is why it's very, very important that we are making sure that they're being done correctly. So the types of provisionals that are available is, this is going to be more like a acrylic type of material. It's going to be more custom because this is the preliminary impression that was taken before the tooth was prepared. We are then going to, using this cartridge system with the extruder gun, extrude or push the material out to this tip, and again, it is kind of spiral, just like the material for the impressions, for the final impression, and it mixes that material as it's being dispensed into whatever it is that we're doing. In this case, we're making a temporary crown. So we put that material into the tooth that we're going to be making the provisional crown, and we seed it into the mouth. We allow it to set up. It does come in different shades. And then we take our low-speed handpiece with our nose cone or straight attachment with our acrylic burr, and we make any adjustments. We make sure that the margin is smooth. We make sure that when the patient bites together, they're not hitting on it too hard. So we make all of those necessary adjustments. But this is going to be more of a customized type of provisional or temporary crown. Next, we have for posterior teeth what's called aluminum crowns. And oftentimes with aluminum crowns, these are considered prefabricated. So it's kind of like a one-size-fits-all. We can kind of customize them by mixing acrylic and putting it into the inside of these crowns. We would then seat the crown on top of the preparation, which then kind of helps to customize it a little bit more. But it's also going to require the use of crown and bridge scissors, because more than likely we're going to have to trim the margin of it to make sure that the tooth is going to fit properly onto that prepared tooth. And we're also going to have to use some crimping pliers to make sure that we are kind of customizing or forming the bottom portion of these temporary crowns onto the tooth, because again, we don't want that to interfere with that gingival tissue that we temporarily displace due to the packing of the cord. So this could be another type of provisional crown that you may encounter in your offices. Again, these are going to be used for posterior teeth only. And again, often a lot of dental offices aren't using this type of material anymore. This is going to be for anterior teeth and also to include bicuspids. Because bicuspids are kind of in the smile line, when you smile, you can oftentimes see your bicuspids. They are kind of using this material. It's a polycarbonate material. These are also prefabricated. It comes in a container just like the aluminum crowns did. There's different sizes, different shapes, depending on what it is that we're doing. So again, it's a lot like a one-size-fits-all. These can also be somewhat customized using the acrylic by placing it inside. That gets placed over the top of the prepared tooth, and then adjustments are made. Again, same thing, we're going to need a low-speed handpiece, the straight nose cone attachment with the acrylic burr to make adjustments to the margins of these and also the occlusal or incisal edges of these provisionals. And lastly, this is something that we use in the clinic. It's still a prefabricated, but the difference with this is that it's a malleable composite material. So once you pick the one that you are wanting, depending on the tooth, and they are made for upper and lower, because remember, our upper bicuspids differ from our lower bicuspids. Same thing with upper molars, lower molars. So with this material, or with this crown, it doesn't require additional equipment or instruments as far as the crown and bridge scissors and whatnot. It's still going to need to be able to adjust it. But with this, as you form it onto the tooth, you're able to customize it that way because it's very malleable type of material. Once you get it formed and customized to fit the prepared tooth accurately, it gets light cured, which then hardens the material. So just like with composite, it's very malleable until you put the curing light on it, and then it hardens it as hard as it's going to get. After that, then adjustments can be made to the margin of it and also the occlusal of it. So these are all the different types of materials that you may encounter in your office. Make sure that you know what they are, how they're going to be used, as well as the whole purpose and function of provisional crowns.